Quick question. Can you tell me the definition of hypotension? If you immediately rattled off a blood pressure of less than 90/60, good, I like it. I'll take that one. That is an acceptable definition. But do you know the definition of hypoperfusion? That one, I would argue, is more important. And I'll tell you all about it on this episode of One for the Road. There is no universally recognized standard definition of hypotension. Since we often set the range for the average normotensive blood pressure to be between 120/80 and 90/60, anything below that we often call hypotensive. But there are plenty of very healthy people who walk around with blood pressures lower than that, and they're perfectly fine. And there are often times when a blood pressure well inside that range can be critically low. The difference in those two patients has to do with perfusion. And it's one of the biggest examples of why we need to be careful not to get too focused on the numbers and instead pay attention to the patient. When I say pay attention, what I mean is understand their history, their medications compliance, their injuries or their illness, and their outward physical signs of health or illness. This is where terms like sick, not sick come into play. When we're asking ourselves if a patient looks sick or not sick, the signs that we're looking for often go straight to perfusion. And those include skin signs. Are they pink? Are they warm? Are they dry? Are they pale, cool, diaphoretic, clammy, ashen? How about their level of consciousness? Are they alert and responsive, or are they tired, listless, agitated, or confused? How does the blood pressure fit with the entire set of vital signs? This is important because normal blood pressure is relative. What we're really asking about is the patient's perfusion status adequate? Is the pressure in their vasculature adequate for their whole body's ongoing oxygen and nutrient needs? For a healthy athlete, the answer might be yes, at a blood pressure of 88/50. For an elderly person with years of vascular disease, chronic hypertension, a high mean arterial pressure, a blood pressure of 136/90 might be totally inadequate. And when that person shows signs of being sick, pale, diaphoretic, confused, we need to be able to recognize that their pressure is inadequate. They are hypotensive in every sense except the number. This would be considered relative hypotension, and we need to recognize it and treat it appropriately. But we can't do that if we're too caught up on the numbers and not enough on the total clinical picture. This is at the heart of what we mean when we say treat the patient, not the monitor. I appreciate you watching. I hope you find that helpful. I'm Steve Whitehead, and that was One for the Road.